Assalamu alaikum dear students. Students, this video is related to the hypothyroidism. Hypothyroidism is a clinical condition. In this video, I will tell you about the clinical manifestations presented by a patient of hypothyroidism. I will also talk about the diagnosis and investigations that we should do in case of hypothyroidism and also talk about the management of the hypothyroid patient. Let's start. Before going to the clinical manifestations, I am going to tell you about the definition of hypothyroidism. Hypothyroidism is a clinical condition in which there is decreased production or release of the thyroid hormone T3 and T4. So if we found that there is a case of hypothyroidism, we should note some important signs to confirm the diagnosis of hypothyroidism. In this case, clinical manifestations may help out vary. Clinical manifestations are divided into the infants and children or adults. In infants, the clinical manifestations of hypothyroidism are oftenly asymptomatic. That means there is no detectable signs or the symptoms presented by the infants of the hypothyroidism. Hypothyroidism infants may show two types of signs: early signs and late signs. In early signs, there is prolonged jaundice, there is pallor. Pallor is the discoloration of the skin of the infant. Next one is larger anterior fontanelle, hypotonia, edema, and hypothermia. In the late signs, there is poor feeding, poor growth, umbilical hernia, developmental delay, and lethargy, along with the macroglossia. These are the signs that are presented by the infants of hypothyroid. And then we talk about the clinical signs of the children or the adults. In this case, the children or the adults show short stature, delayed bone age, puberty delay, menstrual irregularities in case of female children, goiter increase or the enlargement of the thyroid gland, fatigue, constipation, along with the dry skin. So these are the signs presented by the children or the adults in case of hypothyroidism. How we know that there is a patient of hypothyroidism? In this case, we should make a diagnosis. For diagnosis in the infants, we should do routine newborn screening. This routine newborn screening should be used before the clinical signs develop, and if we found there is screening test positive, confirm with the thyroid function test. In case of children, consider ordering a TSH, thyroid stimulating hormone, if there is clinical suspicion of the hypothyroidism. Then we will do about the investigations. In investigations, we found that there are three types of the hypothyroidism. Number one is primary hypothyroidism. It means that there is abnormality in the thyroid gland. In this case, there is decrease in the thyroid hormone T4 but increase in the thyroid stimulating hormone TSH. So if we found that there is secondary or the tertiary hypothyroidism, we come to know that there is a problem in the pituitary or the hypothalamus. In this case, the T4 and TSH, both of these substances or the hormones decreases. In the subclinical type, we should continue to monitor and treat if symptoms or a goiter develop. Management of the hypothyroidism includes two categories: management in the congenital case, management in the adult or the acquired case. In congenital case of the hypothyroidism, we start with levothyroxine immediately, and then we confirm the etiology by ultrasound, thyroid ultrasound, and we also monitor the TSH frequently. In the acquired case, start the levothyroxine and treat until the thyroid stimulating hormones return to the normal. After this, we should check the antithyroglobulin antibodies. Next one step in the management is that we should monitor the TSH every 6 to 12 months and after dose change. So in this way we can overcome the hypothyroidism in a patient. So this is about the hypothyroidism. Thank you very much.